Thyroid disorders have been very commonly linked with pain conditions. Between thyroid disorders, you can have an issue where there can be an excessive change in how the thyroid functions, which is called hyperthyroidism. But more commonly associated with chronic pain is actually a lowered release of thyroid hormone, which is called hypothyroidism. Now, hypothyroidism is a very common endocrine disorder that is more often present in women, and we are now realizing that it can be associated with worsening of chronic pain. And this is something that is not often very well appreciated by the general population and can often be then mistaken or confused as some other problem occurring parallelly to the thyroid issue. So in this video, I'm going to be looking a little bit more deeper into how we can recognize it, what the symptoms are, what you can do to manage it, and what I can then suggest as the next steps in case you think that's an issue. Firstly, let's look at the symptoms that are associated with hypothyroidism. The most common symptoms that everyone is aware of is usually fatigue. There can be weight gain. There can be cold intolerance where people cannot just have the ability to control their temperatures, so they might feel inordinately cold or hot irrespective of the outside environment. And then there are, of course, mood changes, depression often being a common feature. But what is less appreciated is this symptom of muscle and joint aches that can happen in quite a lot of patients who are having hypothyroidism. So it's important to be aware and to recognize that this is also a feature of hypothyroidism. Muscle and joint aches, headaches or migraines, and sometimes you can have overall body discomfort which can impact on your sleep and cognitive function during the daytime. Now, how does hypothyroidism in itself cause pain? There have been many mechanisms suggested, but broadly we think that when there is this hormone imbalance, the lowered thyroid levels itself can cause this kind of change in the hormone levels, and that can predispose the nervous system to feel more sensitized and vulnerable to fire off, and that can be a common factor for chronic pain. A second way that lowered thyroid hormone causes is actually a reduction or a change in the metabolism. Because the thyroid hormone is so important for controlling the basal metabolic rate of the body, the lowered metabolism can also mean the change in the nutrients, and that can also be a predisposing factor for chronic pain. And lastly, we know that certain forms of hypothyroidism can actually change how the nervous system in the periphery gets nutrition. So it causes a kind of peripheral neuropathy, and people can often feel pins and needles or tingling or numbness or altered sensation in their hands or feet. That's the third kind of problem that happens with hypothyroidism and chronic pain. So what are the types of chronic pain that can happen when you have hypothyroidism? The first, as I've mentioned, is the overall muscle and joint ache. So a musculoskeletal kind of pain is seen. The second is this overall wide body discomfort, which can be associated with lowered sleep. And this means that you can have the issue of a fibromyalgia-like presentation. And indeed, fibromyalgia has been very commonly noted in hypothyroid patients and diagnosed itself based on the 2016 criteria. And lastly, headaches and migraine are the third kind of pain that are often seen in hypothyroid patients. So what's the management and treatment of this kind of hypothyroidism related chronic pain? First of all, assessing and testing for the thyroid levels, the level of T3, T4 and TSH, which is most commonly done, is important. And correcting often, giving the thyroid replacement can make a big difference in pain. Other pain management approaches while you're correcting the thyroid levels could involve symptomatic management using some pain medication. Now, these might be anti-inflammatories, depending on the intensity of pain, a very short-term course of stronger medication or nerve pain medication or even opioids. But these all would have to be discussed with your specialist and would have to be considered carefully in light of your personal medical history as well. And then, of course, there are so many other well-evidenced non-drug pain management approaches such as physical therapy, attention to sleep, various lifestyle measures in terms of nutrition, in terms of mind-body techniques, and in terms of pacing and management strategies. This kind of a combined approach can really help in supporting you overcoming your hypothyroidism related chronic pain. So if you feel that your chronic pain or you've developed pain that has been associated with less than satisfactorily controlled hypothyroidism, then this might be a good reason to reach out to your specialist in primary care or secondary care or a pain specialist to get further help and support. Thank you for watching this video, and I look forward to seeing you in the next one. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.